Let's get right into it. Today, in this explainer, we're diving into a seriously fascinating intersection between extreme underwater environments and human physiology. We're talking about scuba diving and kidney disease. Now, this is a medical topic that's surrounded by a ton of misunderstandings, so we're going to unpack the actual realities together using the data. So here is the big question that drives our whole physiological journey today. Can you actually scuba dive if you have kidney disease? I mean, if you ask around the local diving community, you're probably going to hear a lot of folks say it's an absolute automatic disqualifier. But is that what the medical data actually says? Well, let's bust that myth right out of the gate. The answer is actually a resounding yes. A kidney damage diagnosis is definitely not a blanket ban on diving. However, and this is a really critical however, it heavily depends on the cause, the severity, the stability of the disease, and any associated complications. Basically, it's all about a careful, completely individualized assessment by a doctor who actually knows diving medicine. Okay, let's look at why that is in Section 1, Kidneys Under Pressure. To really understand why that individual assessment is absolutely crucial, we gotta look at what happens beneath the surface. I want you to think of your kidneys as your body's essential onboard dive computer. While you're busy looking at your depth gauge and checking your air supply, your kidneys are furiously working behind the scenes. They're regulating your fluid balance, maintaining your blood pressure, keeping electrolytes like potassium in check, managing your acid-base balance, and even handling red blood cell production. So if there's an impairment in literally any of these systems, it can significantly ramp up your risks when you're hanging out 60 feet underwater. Let's break this down further in Section 2, the CKD spectrum. When we map out the different levels of chronic kidney disease, or CKD, you can see a very clear escalation of risks. Think of it like a traffic light. On the mild end, stages 1 and 2, this is essentially a green light. If kidney function is stable, blood pressure is well controlled, and there aren't any major abnormalities, you can often dive safely with very little restriction. Now, moving to the middle, stage 3. This is your yellow light. It requires a really strict individual assessment, because this is where we start seeing concerns pop up, like hypertension, maybe some mild anemia, and reduced exercise tolerance. But lots of carefully selected divers in this stage still get cleared to dive. Finally, on the far end, stages 4 and 5, advanced CKD. This is a flashing red light. Diving becomes highly problematic here due to severe fatigue, significant cardiovascular disease, and a severely reduced physiological reserve. For almost everyone at this advanced stage, recreational scuba diving is a no-go. Now, you might be wondering what happens if the disease progresses to the point of needing dialysis. Well, for those on haemodialysis, recreational diving is usually not recommended. The risks are just too severe. We're talking things like massive fluid shifts, blood pressure instability, cardiac arrhythmias, and potential issues with the dialysis access point itself. On the flip side, we have peritoneal dialysis. Now, this involves entirely different physiological mechanics, but it actually leads to the exact same conclusion. The pressure changes underwater create huge concerns for catheter integrity and infection. So in both cases, this extreme environment is generally considered incompatible with diving. But here is a surprisingly hopeful fact for you. Kidney transplant recipients can actually often successfully return to diving. Seriously. The main requirements are stable graft function with 0 rejection episodes, normal blood pressure, and really good cardiovascular fitness. Obviously, they have to navigate the underwater world with some extra caution, specifically managing the infection risks that come from taking stable immunosuppressive therapy. But a successful return to the water, absolutely possible. All right, moving on to Section 3, hidden underwater risks. Let's dive a little deeper, pun intended, into the specific localized dangers divers face beneath the surface. We'll start with a sneaky one, dehydration. If you dive, you know you always get a bit dehydrated. You've got immersion diuresis, that sudden urge to pee underwater, plus you're breathing bone-dry compressed air. You might have pre-dive heat exposure, seasickness, or just a long day out on a sun-baked boat. But here is why this is a big deal for our topic. When a diver has reduced kidney reserve, these standard everyday dehydration factors get massively magnified. Mild dehydration in a healthy diver, super common. But in a diver with kidney disease, it can trigger some really significant problems really fast. Then there's the oxygen side of the equation. Have you ever heard of erythropoietin? It's a crucial hormone produced by the kidneys that actually stimulates your red blood cell production. When kidney function drops, the production of this hormone drops right along with it, which leads to anemia. And for a scuba diver, Anemia is a major, major hazard. It translates directly to breathlessness, reduced exercise capacity, way more fatigue, and a notoriously poor response to underwater emergencies where you suddenly might need a huge burst of energy. And all of this cascades into even more complex chemistry involving electrolytes and blood pressure. You see, kidney disease can cause high potassium and low sodium. This fragile imbalance predisposes a diver to muscle weakness and cardiac arrhythmias. Combine that with poorly controlled hypertension, which, by the way, is a super common side effect of kidney disease, and the diver faces a sharply increased risk of a cardiac event or a stroke underwater. So it goes without saying, these elements absolutely must be perfectly stable before you even think about hitting the water. We also have to look at exactly why the kidneys are damaged in the first place, because the specific underlying diagnosis completely changes the medical assessment strategy. For instance, with polycystic kidney disease, doctors have to screen for associated intracranial aneurysms and blood pressure spikes. For diabetic nephropathy, they've got to assess neuropathy and retinopathy alongside the kidney issues. Glomerulonephritis? That requires ensuring the disease is actually stable, while lupus nephritis demands a full assessment of lung, heart, or neurological manifestations. The root cause is literally just as important as the kidney function itself. Okay, what about the medications used to treat these conditions? We're talking things like ACE inhibitors, diuretics, SGLT2 inhibitors, and immunosuppressants. Now, while most of these meds aren't absolute contraindications to diving, their side effects require some incredibly careful planning. Diuretics and SGLT2 inhibitors, they massively increase that dehydration risk we just talked about. Meanwhile, immunosuppressants seriously heighten infection risks. You really have to dive with a plan that accounts for your pharmacy. Which brings us to the major plot twist of this whole explainer. Ready for it? Cardiac fitness often becomes the limiting factor rather than the kidney disease itself. Yeah, the unfortunate reality is that the leading cause of death in chronic kidney disease is actually cardiovascular disease. So many patients have underlying coronary artery disease, heart failure, or left ventricular hypertrophy. So paradoxically, your heart health is often the true gatekeeper to dying when you have kidney issues. Let's bring it all together in Section 4, Practical Advice for Divers. So how do we take all this heavy physiological data and actually apply it in the real world? Well, first, we have to firmly establish the absolute boundaries where the risks just fundamentally outweigh the benefits. These are your red lights. Do not dive if you have uncontrolled hypertension, severe chronic kidney disease, or if you're dependent on dialysis. Likewise, symptomatic heart disease, a recent acute kidney injury, or active nephrotic syndrome with severe swelling, those all mean staying out of the water. In these states, the underwater environment is just way too dangerous. But if you have mild to moderate stable disease and your diving physician has officially given you the green light, here is your pre-dive safety checklist. Step 1. Stay well hydrated before and after diving. Step 2. Avoid excessive alcohol before diving. And obviously, never dive when you're feeling unwell. Step 3. Ensure your blood pressure is strictly controlled. Step 4. Dive conservatively. Don't push the limits of the dive tables or attempt really strenuous dives if you know your exercise tolerance is reduced. And Step 5. Regulate your exertion based on your tolerance, ensuring you get regular checkups to monitor your kidney function. This is a straightforward checklist, but it really empowers you to manage your condition responsibly. Which leaves us with this final thought. When a doctor is clearing a diver, are they just looking at their eGFR numbers on a piece of paper? Or are they looking at the incredible adaptability of the whole human system? Deciding who can dive isn't just about kidney function in a vacuum. It's this nuanced, really beautiful balance of cardiovascular health, exercise capacity, hydration, and electrolyte stability. It really highlights how interconnected and brilliantly complex our bodies are, especially when we take them to the absolute extremes of the ocean. Thanks so much for joining me on this explainer. Keep asking those great questions, and I'll catch you next time.